Hey YouTube, my name is Crystal and I'm starting a pregnancy vlog to track my journey to baby number 2. The reason why I want to start this vlog is because there are not many pregnancy vlogs out there that document the journey for women that have systematic lupus, which I have. I was diagnosed with lupus in 2009 or 10, something like that. It was shortly after I had my son. Prior to having my son, I had zero health problems. I wasn't like a health buff and all fit and exercised and ate right or anything like that, but I was relatively healthy. However, probably about 3 to 4 months after I had my son, I started having really odd symptoms such as facial swelling, hand swelling, joint pain, things like that. I went to see a rheumatologist who did some blood work on me and pretty much immediately diagnosed me with lupus. I was in denial for probably about a year. Decided not to do any follow-up or anything like that because I'm like, I don't have lupus, I'm good. Take me a couple of Tylenol and I'm fine. Well, after about that first year, my symptoms started getting worse and I had to break down and start seeing the doctor on a regular basis. I ended up getting put on some immunosuppressants. I started off first with Imuran, then I changed to Celsep, and then went to methotrexate, and then recently got switched back to Imuran because I told my doctor that I did want to have another child, and Celsep and methotrexate are two very dangerous drugs to have while you're pregnant. So Imuran is the safest immunosuppressant to be on for those that have lupus. My lupus has been in remission for probably about 8 months. The drugs that I'm on to keep my lupus in remission are pretty much all in this bag here. Got my bag of drugs. What I'm taking is 150 milligrams of Imuran, 5 milligrams of prednisone, 150 milligrams of Plaquenil, 81 milligrams of baby aspirin, what else? And 4 milligrams of folic acid. So that's what I take every day to pretty much keep me healthy. Right now my lupus, is very quiet. All my lab work is normal, and part of that is due to the drugs, but some of that is due to pregnancy. Today I am 8 weeks and 1 day pregnant. I got an ultrasound at 7 weeks pregnant, and I'll show you that here. This is the baby at 7 weeks 1 day. Today I went for a second ultrasound to measure, just make sure everything was on track, and still measuring really good. Let's see if I can get that perfect right there. Okay. Baby is measuring 8 weeks and 1 day. Heartbeat is 168. The heartbeat last week was 149, so the heartbeat has increased, and according to old wives' tale, that means that it is a girl, which I'll be very happy with a girl because I already have a boy. However, if I end up having another boy, just as happy, long as the baby is healthy. What else? Oh, another thing, went to the doctor today. I don't know how many doctor offices do this, but when my doctor first sees an OB patient, he go ahead and he bills them for delivery. His delivery charge is about $4,000. Then he factors in your insurance and everything like that, and then he comes up with a total that you're responsible for. Then he takes that total and breaks it down on a monthly basis for payments that you have to make. And today I got my little write-up of what I'm supposed to pay, and looks like I'll have to be paying $298.34 every month for the next month until I have the baby. So that's here, kind of, I don't know if you can see that, spelling out everything that I'll be charged for. That's kind of weird to have to pay for the baby before the baby even gets here, but you know, such is life, long as everything turns out fine. This is my 5th pregnancy. My first 3 pregnancies ended in miscarriages. The first 2 miscarriages I had to have DNCs to remove the products of conception, and the 3rd pregnancy I ended up just miscarrying naturally. Decided I didn't want to have any more surgery, so all those miscarriages were right around the 8-week mark. So the fact that I have made it to this day is a huge milestone for me. What else? Well, I think that's pretty much it that I want to talk about today. Oh, one more thing. I am considered high risk, of course, because of the lupus. So with being high risk, I will be seeing several different doctors during my pregnancy. My next appointment will be with the high risk OB, and she is supposed to run the NT scan, which is for Down syndrome. I'm going to get that performed. I'm also going to get a test for cystic fibrosis and some other testing along the way to make sure that my lupus and the lupus meds are not affecting the baby. One of the risks of being pregnant with lupus, besides preterm labor, miscarriages, and some other things, is that the baby can have a heart condition. But I think if the heart condition is caught really early on, it is treatable. So they will be monitoring me a lot this pregnancy to make sure that everything is fine with the baby. With my son, I end up going into labor at 35 weeks. So he was early. He spent 10 days in the NICU. And so because of that, my OB decided that I will be getting progesterone shots weekly to make sure that my uterus stays quiet and doesn't start contracting and things like that. So not really looking forward to those shots. My husband will probably be the one that administers those, because I can't imagine having to give myself a shot, but you know, who knows? You do anything when you're trying to have a baby. But that's it in a nutshell. I'm not sure how often I'll be updating this blog, but hopefully you guys will subscribe and stay with me and encourage me along the way. Thank you.